Hello, PsychU community, and welcome to today's discussion as part of our PsychU series dedicated to Mental Health Awareness Month. My name is Dr. Aneta Fornal. I'm the Clinical and Scientific Director with UTSCA Field Medical Affairs. I'm joined today by Dr. Dante Durand, who is an Associate Professor and Vice Chair of Clinical Services in the Department of Psychiatry and Behavioral Sciences at the University of Miami Miller School of Medicine. Dr. Durand is also the Chief Medical Officer for Jackson Behavioral Health Hospital in Miami. So welcome, Dr. Durand, and thank you so much for taking the time to provide your perspective on the significance of Mental Health Awareness Month.
Well, thank you for the invitation. I really appreciate that invitation for today's interview.
Perfect. So, Dr. Durand, what does May Mental Health Awareness Month mean to you?
Well, to me, first of all, the May Mental Health Awareness means a great opportunity to honor the millions of Americans that deal with mental illness. I think this is a very important month, just to honor all of them, all of the patients that suffer from mental illness. In addition to that is an opportunity for many of providers who work with patients with mental health issues to actually bring up to the public a little bit more of knowledge of what mental illness is, and also to help decreasing stigma about mental illness, which is a major challenge that we have here. Also, we need to recognize that mental health issues are more common of what people think, and providing adequate information to the public and to promote early recognition, of mental health issues is so important. And finally, also to me, this is a great opportunity also to advocate for policies, to support the treatment of mental illness.
Perfect. Thank you so much for that perspective. A lot of work to be done, focusing on it probably in 12 months out of the year, but maybe specifically in May, really truly being dedicated to that. That's great. So how do you or your organization celebrate Mental Health Awareness Month? Is there anything special that you guys do or you do?
Yes. Well, due to the COVID pandemic, unfortunately, the activities scheduled in May last year were placed on hold. However, in the past, our organization has sort of like participated in walks, to raise mental health, awareness. And also, I remember one year, the staff also was wearing a green bracelets to commemorate this important celebration. Now, this year, this coming month, actually, in May, the Department of Psychiatry at the University of Miami will sponsor and will participate at the NAMI, the National Alliance for Mental Illness Walk for Mental Health Awareness on May 21st at a museum park here in Miami. So this will be sort of like evidence that we really are supporting, mental health awareness. So we actually have communicate this to our faculty and to just attend that important event. Now at the personal level, what I have done is I usually this month is very special for me because I work in mental health, and I usually provide family and friends with more information about this, provide tips on how to keep a good mental health in general, talking about physical activity, talking about ways on how people can maintain their mental health. In the current times, people is very stressed about what goes on, in the world in general with the pandemic. So, talking to them about that is something that I enjoy doing. And also, I provide sometimes donations to support programs that will increase the resources to treat mental illness.
That's wonderful. So certainly a lot of opportunities, not only from a professional, but also personal level to really continue that open dialogue, right, around serious mental illness and how important and vital mental health is to all of us, right? We all have mental health to take care of. And lastly, Dr. Durand, what are some items that you wish healthcare providers were aware of regarding mental health?
Yes, I think we have some opportunities, no, to actually among the healthcare providers in general. The first thing I will say is that to decrease the stigma. I think even among healthcare providers outside of psychiatry, psychology, there is still a level of stigma that is worrisome. And I think we have some opportunities there to decrease that. I would like also, healthcare providers, to be aware that patients with mental health issues, have multiple medical comorbidities that unfortunately that they don't get treated as as soon as they're supposed to be, because, particularly patients with severe mental illness and chronic mental illness, they tend not to go to a physician, for regular medical checkups. They don't take their medications as they're supposed to. So I think bringing up, a little bit more awareness on that, it will help, healthcare providers to actually take with a little bit more cautious when they treat these patients, because sometimes, and I can tell you my personal experience, I've seen patients who only come to see the psychiatrist. They don't really see other specialists. And whenever they go and see a primary care doctor, they might not see him again in a year, and they might not be compliant with the medications or with the orders they provide. So I think our colleagues, in other specialties, in other professions, should really be fully aware of these challenges and how these people really, don't get the medical care they're supposed to. There is actually even research that supports that the fact that patients with mental health illness, they actually don't get the same medical care than patients without mental health illness because of the challenges, as I mentioned earlier. And I think also, for them to, improving early recognition of mental health issues. I know some, healthcare professions are good at that, but, recognizing and then provide appropriate referral early on, or treatment sometimes, they might start an antidepressant or an anxiolytic for patients who really need it, but then make appropriate referral. Early recognition is very important. So I think that's another area that I will stress. And at the end of the day, this will reduce, the suffering of patients with mental health issues.
Wonderful. Yeah, certainly a great opportunity for education, right, for our healthcare colleagues outside of the mental health space. So with that, well, thank you so much, Dr. Durand, for providing your perspective and I think really helping us uncover some ways in which we can all play a role in raising awareness and enhancing the lives of individuals with mental health challenges. So thank you so much.
Thank you, Aneta, and thank you. And we celebrate May. We're looking forward for celebration of mental health awareness.
Thank you so much.